I'm excited to present our work about reimagining wearable-based digital contact tracing for Kenya, Côte d'Ivoire. This is a paper that got accepted at Côte 2025, and it was a work that I conducted when I was a postdoc at EPFL Spring Lab. So before I begin, I want to tell you a short story. 4 years ago, Kai was supposed to take place in Japan, but like everything else in 2021, it didn't go as planned. Yes, COVID-19 reshaped the world. And as a souvenir, Kai sent me this beautiful mask. The Kai logo on the mask was inspired by the famous Great Wave of Kanagawa. And now it reminds me that COVID was a wave that disrupted everything we knew, especially in global health and technology. So this year, Kai is finally back in Japan, and I'm here to discuss digital contact tracing, or DCT. So DCT is a topic that is less of a hot topic now compared to the COVID era. But considering the emerging outbreaks, it still holds relevance. But what is DCT? Let me define. DCT refers to technology-based solutions designed to identify individuals who may have been exposed to a contagious disease, enabling rapid response to contain its spread. Since COVID-19, DCT has evolved, but its challenge remains, especially in regions with limited smartphone access and unique social dynamics. That's where our research comes. Let me explain the challenge. Many people in low and middle income countries, or LMICs, particularly in Africa, don't own smartphones. Most DCT solutions were designed in Western context without considering the unique challenges of LMICs. And this gap is not just a technical issue, it's a public health challenge. It leaves large populations in LMICs already vulnerable to outbreaks like tuberculosis, cholera, and respiratory infections. So how we do rethink the DCT? Basically, we think that wearable technology offers a promising alternative. And unlike smartphones, wearables are cheaper, more accurate, and don't require smartphone ownership. So in this work, we focus on two countries, Kenya and Côte d'Ivoire, located in East and West Africa, to explore how wearable-based DCT could work in these settings. And we ask, what are the incentives and challenges to adopting wearable-based DCT in Kenya and Côte d'Ivoire? What potential remedies could address these challenges? And what are the expectations and preferences of users regarding the design and functionality of wearable-based DCT? Okay, let me talk about the methodology. So we first developed a technology probe to gather user insights and design ideas. It was a wearable ultra-wideband proximity sensing device that can detect relative distance between different devices. We call this Wearable Proximity Platform, or WPP. The participants wore these devices during a day, and this helped us to better introduce the concept of DCT to them and gather feedback on how they interact with the device. We conducted field studies in 4 locations, engaging over 90 participants. We work with participants from 2 key groups: healthcare workers, who are frontline responders with direct experience in outbreak management, and rural non-healthcare workers. These are individuals living in low-resource settings where access to healthcare is limited. And each field study involved pilot deployments, semi-structured interviews, and participatory design workshops. The participatory design sessions combined different activities, including social activities, in-depth focus groups discussions, and crafting and prototyping sessions. Now, let's look at the main findings. So what could prevent people from using DCT? Our study revealed several key barriers preventing the adoption of DCT in Africa. The most significant barrier was related to the lack of awareness and misconceptions. Many participants, mostly in rural areas, were not familiar with contact tracing. Some even have misconceptions, believing that wearing a DCT could automatically detect disease or even cure them. For example, a participant said, whenever I wore the device, it would just kind of automatically detect if I had any kind of diseases. I just want, even by wearing the device, to be cured directly. On the other hand, religious beliefs and misinformation also played a role. So some participants feared DCT devices could cause diseases or even be used to control their lives. For example, another participant mentioned, some people were saying, you never know this thing, means the device. This can be infectious, it can cause a certain disease, or these guys, means us as the researchers, may even control your life using this gadget. So lastly, they mentioned that during COVID time, many people dismissed it as a witchcraft, and this caused to widespread COVID illness in the area. So beyond barriers, our participants also shared key insights into how cultural and social factors influence DCT adoption. So social stigma is a major concern. People feared being judged or questioned for wearing an unfamiliar device. Some even shared personal stories about hiding WPP from their friends or neighbors. For example, a participant said, I was going back to the village with the wearable blinking around my waist, and people thought I had a bump. So to address this, some participants preferred discrete wearables like wristbands, necklaces, or even a device that looks like a flash drive. But also others suggested making wearables more culturally acceptable. So participants suggested designs inspired by familiar items like traditional jewelry. For example, some propose Shanga-style bracelets, which are widely worn in the Maasai community in Kenya. Also, participants preferred clear, non-anxiety inducing notifications. This will favor vibration. They would favor vibration or discrete alerts over loud sounds. Some participants wanted proactive alerts, meaning that it may warn them about high-risk areas rather than just reactive quarantine messages. This is indeed a promising approach, but it can raise privacy and ethical concerns that need further investigation. Since many rural areas lack reliable electricity, participants emphasize long battery life and even suggested solar-powered solutions. Devices must also be waterproof, dustproof, and shockproof to handle tough environmental conditions. Next, on top of these findings, they wanted small, lightweight wearables that blend seamlessly into daily life without disrupting chores, work, or routines. For example, a participant said, yesterday I needed to wash dishes, but I was a bit afraid that it could even fall inside water. So as such, I would like something that is pinned, something that cannot, drop when you are busy running your errands. Beyond design and usability, participants shared policy-level strategies to improve adoption. As mentioned, lack of awareness is a major roadblock. So if people don't understand DCT, they won't trust or use it. For example, a healthcare worker mentioned, about contact tracing and disease management, what we lack with our people is health education. We really need to do a lot of health education and sensitization continuously for our people. So participants also mentioned They would trust local healthcare workers, volunteers, and even religious leaders, and not just government officials to spread the awareness. For example, one of them said, people would agree to someone who speaks their language. So when you go there, they see you, hey, you are one of them, and you wear like them. While mandates helped during COVID-19, many participants opposed making DCT compulsory. Instead, they favored education and voluntary participation to encourage lasting adoption. For example, a healthcare worker mentioned, if it is done under coercion, I don't think it's the right thing to do. Any change will always come with some resistance, unless you first make people understand and let them participate voluntarily without really forcing it. So for DCT adoption to succeed, education, affordability, and trust must come before enforcement. To conclude, our study emphasized the importance of designing DCT solutions that fit the context of Kenya and Côte d'Ivoire, rather than relying solely on Western developed systems. And wearables could transform DCT in Africa, but success is just about technology. It depends on so many factors, such as cultural sensitivity. And culturally sensitive design should navigate and balance discreteness and visibility in a way that while the device should not show off, it should be aligned with traditional custom or jewelry. So we suggest collaborating with local artists and designers to help creating these socially acceptable designs. DCT's future extends beyond COVID-19, so it must be adaptable for disease like Ebola and tuberculosis, and even for the future disease X. Finally, the next step is real-world testing to ensure scalability and lasting impact. Thank you very much for listening.